Hello, this is Dr. David Green, CEO of the Colorado Pain Network. The topic today is an overview of failed back surgery syndrome. Well, what exactly is it? Failed back surgery is when the outcome of low back surgery fails to provide the desired outcome. And the result is chronic pain, which is termed failed back surgery syndrome. It's one of the most frustrating things a patient can deal with since he or she went the surgery route hoping for a pain-free outcome and it just didn't happen. How big of a problem is it? Studies show that up to 40% of all back surgeries fail. 10% of back surgery patients actually end up worse than they were before. Each additional surgery that is performed has a lower chance of success than the one before. It can be an exceptionally depressing situation. Why does it occur? The first reason is that surgery could be performed for the wrong reason. This is the 50% rule. For instance, with degenerative disc disease, you might as well just roll the dice. A lot of times it's the wrong disc or you have a 50% outcome. Surgery performed for the right reason, but the person was left with residual pain. It may be a technically perfect surgery, but the cold, hard truth is that a lot of times you just don't get rid of 100% of the pain. You might get rid of half of it. Is that enough for the patient to be happy? Okay? Or are they still going to be miserable? It could be that the surgery was inadequately performed with some technical errors. It might be that fusion just didn't occur. No fault of the surgery itself, it's just a biological situation. And then the hardware could break. And it also may be that the outcome was satisfactory initially, the patient was satisfied, but then scar tissue can form around nerve roots, painful hardware can occur, or adjacent segment degeneration. Here's an example of adjacent segment degeneration. You have a fusion that went one level, two levels, okay? Hardware on one side and then hardware on the other. What happened is the fusion was successful at these levels, but the level above, you can see here, see this disc is down from the level above. There's some overgrowth of bone going backwards and forwards. So it's extremely arthritic, and that's adjacent segment degeneration. These levels can't see any more stress because they're fused. They don't absorb anything. They just send them above or below, and that's why this is so degenerative. What are the symptoms of failed back surgery syndrome? Well, usually it's daily back pain that's chronic, and it can radiate into the right and left side of the low back. It can have spasms and aching. And it also may be associated with some leg pain and burning, known as sciatica. The treatment options are numerous. First of all, the patient should have a surgical evaluation. If there is an indication for surgery, it can help dramatically, for instance, for broken hardware, adjacent fractures, something to look at. Physical therapy and chiropractic treatment have been shown to be excellent benefit. This may include modalities such as ultrasound, electrical stimulation. Spinal decompression therapy has been shown to be excellent. It's not indicated, though, if there's hardware in place. For a non-instrumented fusion, it can be an excellent treatment option. Acupuncture can be helpful along with medications. This may be over-the-counter medications such as Tylenol and Advil, or it could be chronic narcotic medications depending on the patient's situation. Interventional treatments, there are quite a few. Trigger point injections are subcutaneous injections that can help with spasms and aching in the muscles. Hardware injections to see if hardware is a source of the pain. For instance, if you inject around the hardware and the pain goes away, it may be that the hardware should come out. Facet or medial branch blocks. Here are the facets on the left side and the facets on the right. If those are the source of the pain, it can be very helpful to inject cortisone into those joints. Injecting cortisone around those joints and some numbing medicine can be helpful. These little nerve endings you see here are called medial branches, and blocking the transmission of those can be very helpful. If those work and then wear off, what you see here is a catheter going in and heating up this area around the joint. That's called a radiofrequency ablation. That can provide pain relief anywhere from 6 to 18 months. It can be very helpful. If nerve roots are getting pinched or inflamed and irritated, epidural injections can be very helpful as well. Spinal cord stimulator implant is an absolute last resort. It's been revolutionary, though, for failed back surgery syndrome. They have gotten dramatically better technologically over the last decade. It's actually good for both back and leg pain, and over 200 programs are available in the unit. over three-fourths of patients do extremely well. It doesn't fix the problem. The issue is that if the problem can't be fixed, why not mask the pain? And that's what a spinal cord stimulator implant does. The battery pack and programming unit is the same, and it sits subcutaneously, usually just above the buttock area so it doesn't get sit on. And then these leads come in to the area around the spinal cord and then provide electrical impulse, which changes the way the brain perceives pain signals. Colorado Pain is the top pain management centers in the Denver metropolitan area. They also have locations in Buena Vista and South Granby. They accept over 50 insurances. The board-certified pain management doctors have won the Patient's Choice Award 5 years in a row. The number to call for scheduling is 720-306-9575. And visit us on the web today at painmanagementdenverco.com. I'm Dr. David Green, CEO of the Colorado Pain Network. Your pain stops here.